Okay, so now let us look at the vertebral bones, the bones that make up the vertebral column. Okay, we are saying that the vertebral column is made up of several vertebral bones. It is made up of 7 cervical bones. Those are the bones that are found along the neck. Okay, it is made up of 12 thoracic bones. Okay, it is made up of 5 lumbar bones. All right, it is made up of 5 um, 5 sacral bones. All right, it is also made up of 4 coccygeal bones. So that is what we are talking about. We are talking about the vertebral column, which is also known as the backbone or the spinal column, also known as the backbone or the spinal column. Okay, the vertebral column, the sternum, and the ribs form the skeleton of the trunk of the body. It consists of bones and connective tissue, spinal cord that it surrounds and protects, consists of nerves and connective tissue. At about 71 centimeters in an average adult male and about 61 centimeters in an average adult female. Okay, this vertebral column is strong, flexible, with elements that can move forward, backwards, sideways, and they rotate. In addition to enclosing and protecting the spinal cord, it supports the head and serves as a point of attachment for the ribs, as well as for the pelvic girdle at the pelvis and muscles of the back and upper limbs. It has a total number of 33, okay? As the person is developing. As a person grows, several vertebrae in the sacral and coccygeal regions fuse. As a result, the adult vertebral column typically contains 26 bones. So that is what we are saying. We have this vertebral column. This is the anterior view. You're looking at this person from the front. They are going to have 7 cervical vertebrae. Cervical vertebrae are the vertebrae that are found on the neck region. Okay, we have 12 thoracic vertebrae. 12 thoracic vertebrae found at the thoracic cavity. We have 5 lumbar vertebrae. 5 lumbar vertebrae found at the abdominal cavity. And we have 5 coccygeal sacral vertebrae that are fused together to form the sacrum. And we have 4 coccygeal vertebrae that are also fused together to form the coccyx. So those are our vertebrae. So we have 7 cervical. This is now the lateral view. And you will notice that each one of them has different features depending on where they are. We have cervical vertebrae, which are the smallest. We have thoracic vertebrae that are 12 in number. We have the largest being the lumbar vertebrae, 5 of them. We have these ones that are fused over here. This is what makes up that curve of the bum, okay? And we have the coccygeal vertebrae at the bottom there. You will also notice that between each vertebra, we have a piece of cartilage. This cartilage that is between these vertebrae is the fibrocartilage, okay? Fibrocartilage, which allows for this spinal cord to be, for this vertebral column to be flexible, you can bend forwards, backwards, on the sides, you can even rotate, okay? Because there is these intervertebral discs. These are fibrocartilage in nature, and they provide a cushion so that even when you put something heavy on your head, these the vertebral bones are not going to be having friction against one another, okay? When you look at this person from behind, this is the posterior view, and you will be able to even see, and this the vertebral column, this is what you're going to see. You will notice that the cervical vertebrae have a spinous process which is bifurcated. They look like they are two, okay? And then the rest will be like that. All right, this is the posterior view of the spinal of the vertebral column. All right. Also, this diagram here is now showing us the articulations of the vertebral column, the vertebral bones. So these 12 thoracic vertebrae are articulating with the 12 ribs on the posterior aspect. On the anterior aspect, these ribs will articulate with the sternum, the first 7 ribs, that is. At the pelvic region, the 5 sacrovertebrae are going to articulate with this bone, which is the os coxae, or the coxal bone, okay, or the hip bone, also known as the innominate bone. So that is how these bones articulate. Now, when you look at the vertebra, each vertebra has its own features depending on where it is found. So the cervical vertebrae have features that distinguish them from other vertebrae. The thoracic vertebrae have features that distinguish them from other vertebrae. We have the lumbar vertebrae, which also have features that distinguish them from other vertebrae. Okay, so those are the vertebrae. So they are going to all have different distinguishing features. We have when you look at the cervical vertebrae, it's going to have its own features. Okay, so before we go to the cervical vertebrae, let's look at the common features that you're going to see on each vertebra. One, a vertebra is supposed to have a body, okay, which articulates on the top and at the bottom with an intervertebral disc, the way this diagram is, okay? Each vertebra is supposed to have this projection in the middle. This is the posterior side. This is the anterior side. This projection in the middle is called the spinous process. These are the processes that you are able to feel even when you touch yourself behind. Each vertebral column, each vertebral bone is supposed to have these projections in the sides, these that look like wings. These are known as the transverse processes. Okay, the functions of these processes are for attachment of muscles. Okay, for attachment of muscles. And then the other thing that you will notice, that vertebrae should have a foramen in the middle for the passage of their spine. So those are some of the features of a typical vertebrae. However, every vertebral bone is going to have specific characteristics that are going to distinguish it from other vertebrae. For example, when you look at these vertebrae here, these are cervical vertebrae. If you look at this picture here, it is showing you nicely how the vertebrae are. Now, the naming of these vertebrae is in relation to where the vertebral bones are. The cervical vertebrae, with the word starting with C, they are going to be called cervical 1, cervical 2, cervical 3, and these are therefore going to be shortened as C1, C2, C3, C4, C5, C6, C7. These are the 7 cervical vertebrae. We said that along the neck we have 7 vertebrae which are known as cervical vertebrae. The first 2 have specific names. They are even different from the way others look. Okay, the other 5 look the same, but the first 2 are differently made. We have the first one being the atlas. If you notice, it has these facets on top here for the articulation with the occipital bone. Okay, for articulation with the occipital bone. So here, this is how when you remove this C1, also known as the atlas, from the rest of them, this is how it's going to look. You're going to have those articular surfaces where they are going to articulate, where this bone is going to articulate with the occipital bone. It has a huge foramen for the passage of the spine. Also, it does not have a body, okay? It does not have a body. It has the transverse processes. Also, the other thing you will notice is that just like these other cervical vertebrae, it has these foramina on the sides. These are known as the transverse foramen. This is where we're going to have the internal carotid pass. Okay, this is where the internal carotid is going to pass all the way from the thorax to the cranial cavity. The second cervical vertebrae is also known as the axis. This one is also different because it has this projection on top. This projection is known as the dens. The dens, this one, is used to articulate with the atlas. So this dens enters and sits right here so that it allows for someone to be shaking their head when they are refusing, so that your head can move from side to side. So there is a rotational kind of allowing to happen at this point. All right. When a person is hanged, okay, this dens is likely to break, and therefore it will cause destruction of brain tissue and the patient will die. Okay, these are the 2 different cervical vertebrae. The other 5 look the same. They have a small body, they have the transverse foramen, they have the spinous processes. These spinous processes, like I said earlier, they bifurcate. So it's as if there are 2 of them. That is how cervical vertebrae are made. Okay, now, like we were saying, the other region that we want to talk about is the thoracic region. This thoracic region, this thoracic region also has vertebrae that has its own features. Obviously, the body will be there. Obviously, the transverse processes will be there. Obviously, the spinous process is going to be there, and the vertebral foramen. However, we are going to find that these vertebrae for the thoracic region have an articulating surface on the side of the transverse process where there is going to be articulation with the ribs. Okay, so that is one of the distinguishing features. Another distinguishing feature will be the size of the body. It is just slightly bigger than the cervical vertebrae and yet slightly smaller than the lumbar vertebrae. Okay, that is how you're going to differentiate it. These are 12 in number. And then we have lumbar vertebrae. Okay, we have lumbar vertebrae. Lumbar vertebrae are also 5 in number. They are named according to, by the way, the thoracic vertebrae are also named according to where they are. So you're going to name them as T1 starting from the top. So where C7 ended, the next one should be T1 all the way up to T12. And then the next region will start, that is the lumbar region. And so we're going to have L1 up to L5 because in the lumbar region, we only have 5 lumbar vertebrae. Now, these lumbar vertebrae, they also have specific features that differentiate them from other vertebrae, okay? From other vertebrae. One thing that we'll notice is that the body is big, the foramen is small, okay? Those are the things we should take note of when we want to differentiate the lumbar vertebrae from other types of vertebra. Okay, that is what we should think of. All right. Then we go to the sacral vertebrae. The sacral vertebrae has 5 vertebral bones fused together in such a way that they make a triangular bone. Okay, they make up a triangular bone. So just like this, when you look at it, you have S1 sacrovertebra 1, sacrovertebra 2, sacrovertebra 3, sacrovertebra 4, and sacrovertebra 5. So that is S1 to S5. All right, nerves are going to pass through these foramina here, okay? And then we have at S1 here, we have a protrusion here. This is known as the anterior sacral promontory. This is the anterior aspect of this sacrum. This is the posterior aspect of this sacrum. There you're going to see an articular portion at which the S1 articulates with L5. Okay, and then we have the 4 coccygeal vertebrae because we already have C at the top. So now we are going to call it CO1, CO2 until CO4 because there are 4 coccygeal vertebrae. When you start looking at the rib cage or the thoracic cavity, you have noticed that posteriorly we have the thoracic vertebra. Anterolaterally we have the ribs. Medially, in the anterior medial aspect, we have the sternum. The sternum is also known as the breastbone. It is also known as the breastbone. It measures 15 centimeters in length and consists of 3 parts. It consists of the manubrium. This is the sternum, okay? It consists of this part, which is the manubrium, okay? The manubrium articulates with the clavicle. It articulates 1 with the clavicle, okay, and 2 with the first rib. So it has articular surfaces for the clavicle as well as for the first rib. And then the second part is the body of the sternum. And the last part is the xiphoid process. The xiphoid process. That is what we're talking about. So the ribs increase in length from the first through to the 7th. and then decrease in length to the 12th rib. Each rib articulates posteriorly with its corresponding vertebra. Okay, we have true and false ribs, and then we have floating ribs. Okay, we have true and false ribs, and then we have floating ribs. We have these first 7 ribs that are coming all the way from the back, all the way from articulating with starting from T1, T2, T3, now up to T7. These ribs will come all the way from T7 and come and articulate with the sternum in the front. These are known as true ribs. And then we have ribs number 8, 9, and 10, which articulate with rib number 7 in order to go and articulate with the sternum. Those are known as false ribs. And then we have 11 and 12, which articulate with T11 and T12, but in front, they are just floating and they don't articulate with any other bone on the anterior aspect, and therefore they are known as the floating ribs. They are therefore known as floating ribs. Okay, the spaces between the ribs are known as intercostal spaces. Each rib has cartilage, which is hyaline in nature, that articulates with the anterior end of the rib and connects this anterior end of the rib to the sternum, and this cartilage is known as costal cartilage. It is known as a costal cartilage. That is what we are calling it. So here are some ribs that you may want to look at and see the parts of a rib. Okay, so most ribs, we have true ribs and false ribs. Then we have typical ribs and atypical ribs. So we have these true ribs that will have the facet for articulating with the costal cartilage at the anterior aspect, and at the posterior aspect we have the head, the neck. Okay, there's going to be a tubercle over there. All right, there's going to be another articular facet. Okay, so those are some of the features of the ribs. Those are some of the features of the ribs. Okay, some of the medical application of anatomy in relation to the vertebral column includes scoliosis. Scoliosis is when the vertebral column is bent sideways. All right, this is scoliosis. Then we have kyphosis, where you have protrusion of the spine of the vertebral column at the level of the thoracic cavity. And then we have lordosis, where the bum comes out, points out extremely, and in the middle here it goes in. So that is the way that the pregnant women look. That is what we are going to call lordosis. That is what we're going to call lordosis. Okay.